I certainly, and many of my colleagues, think that this virus is already gone pandemic, and that means that the virus is spreading from person to person in more than one region of the world. And if we think about what's happened over the past few days, not only do we have a major outbreak in China, but we've started to see quite significant chains of human to human transmission in places like the Middle East, in Iran in particular. We're also seeing quite a large extended outbreak in Italy. And importantly, these are outbreaks that have been caused by the introduction of a virus, and the source of that virus is unknown. So I think, clearly this is a virus that has the potential and is indeed spreading quite well within various communities.
I saw a report that in China it seems infections are kind of plateaued or declining, but are we seeing the virus pick up in other parts of the world, and is that something we should be worried about?
Yeah, I think the data coming out from China is probably a product of the lockdown of Wuhan city and also the wider Hubei province. So, as that virus has gone through that population, it's starting to decrease in terms of the number of infections that it's caused. But of course, what we do know is that the virus has gone to other parts of China. And so I think many of us are expecting those numbers to start to ramp up again as the virus continues to spread in other parts of China. And I think also what we're seeing in other parts of the world, for example, South Korea, Italy, and the Middle East, is that those outbreaks are also going to gather pace. So I think, that certainly whilst the decrease in China is encouraging, I think many of us feel that this virus is probably going to be almost impossible now to eradicate, and therefore we need to be prepared for the cases that we're likely to see over the coming months.
And so how can Britain and other governments around the world contain COVID-19 pandemic?
Yeah, I think it rather than containing it, I think the best thing that they can do is to slow it down. And I think the measures that we've seen introduced, so at the moment it's still a case of trying to identify cases, to isolate those cases, and to try and prevent onward transmission. And that's certainly working in places that have incredibly good surveillance. And we are fortunate in the United Kingdom to have some of the world's best surveillance systems in place. But of course, what the concern is whether or not that virus can come into the country under the radar in an individual who's not travelled from a high-risk area but still be infected. And then what we have the potential is for under-the-radar community spread, and that's why the government announced yesterday that they're going to introduce more widespread testing for the coronavirus. So particularly if somebody presents in hospital with serious disease, they will be tested for the presence of the coronavirus, but also the establishment of what we call sentinel centres. So these are centres around the country that will, as part of routine surveillance, start testing for the presence of the virus.
The Sun has today seen a leaked government memo which details a worst case scenario in which 80% of Brits could become infected with COVID-19. Is Britain prepared for this kind of scenario?
Well, I think, it's always difficult to understand exactly how this virus will behave. I think the one thing that we do know is, or there are several things that we do know. One is that this is a virus that seems to be easily transmitted between human to human. We also know that in the majority of cases, the virus produces very mild symptoms, and that allows the virus to spread fairly easily because there are no red flags raised when somebody becomes infected. And so, the other thing that we know is that this is a virus that has the potential to cause serious disease and can cause death. So whilst we expect the numbers to increase, we can't get a real handle on exactly the impact that it will have on the population. We are a naive population in that we've never seen this virus before. None of us will have any existing immunity, and so all of us potentially are susceptible to the infection. So we should expect to see potentially lots of people who would become infected, and so what we need to do is slow down the rate at which that happens to allow the NHS to deal with the consequences.
Do you think the NHS could cope with a worst case scenario?
It would be very difficult under the current situation if we think about the what happens in a poor seasonal flu season. Then clearly the NHS struggles to cope with the extra winter demand, and I think if we layer on top of that an outbreak of a virus that we've never seen before, a virus that can cause serious disease, something that can result in hospitalisation and death, then it's very questionable whether the systems can cope. And I think even if they can cope, it will inevitably have an impact such that lots of other routine procedures, operations, etc., will have to be cancelled to deal with the upsurging cases. But that's why it's important that we all do our bit to try and slow the virus down.
In this memo, I think the government sort of estimates they put on a worst case scenario in terms of death rate was 500,000. I mean, do you think that could be a realistic number if we saw an infection rate of 80%?
It's very difficult because I think one of the things that's clear from the outbreak in China, which is where we've seen most of the cases, is the total number of cases, the total number of people infected is likely to be far greater than what is currently being reported at the moment. And so therefore we have to take all these figures with a little bit of caution, because we don't know the true rate of serious disease and hospitalisation, and we don't know the true rate of case fatalities, so the true death rate. And until we have a better idea of that, it's very difficult to put a figure on it. What the NHS has to do is prepare for the worst case scenario, and if those are the figures that modelers have come up with, then fair enough, that's how they need to base their activities around. But don't be surprised if it's not as bad as that, but it may well be as bad as that, and that's the trouble. It's difficult to predict.
Does this infection have the potential to reach the same kind of infection rate as the Spanish flu?
So with the Spanish flu, again, it's always difficult to put exact hard numbers on this. So we think globally it killed anything between 50 and 100 million people, and the sort of estimates for the case fatality rate were around sort of 1 to 2%. At the moment, the SARS coronavirus fatality rate is very similar, 1 to 2%. But as I say, I think most of us expect that to go down significantly when we understand fully the number of people who have been infected and have very mild disease. But it has the potential to cause serious disease and to kill people. It's a new virus. We've never seen it before. So, you have to consider the worst case scenario to ensure that you're properly prepared for it.
Across the country, we've seen schools closing to sort of carry out deep cleans, and students have been told to self-isolate for 14 days, I think it was. So obviously there's going to be quite a few worried parents out there. Is there any advice you could give to parents about how they can best protect their kids?
I think, this is in response primarily and predominantly to trips to the worst affected parts in northern Italy. And of course, if people have travelled back from those areas, then there is the potential risk that they might be infected. And I think, the advice for those people is the same for anybody who's coming back from a badly affected place. There's a list of places on the government website, and that is to self-isolate for 14 days. And that means literally to do that. You stay as much as possible in a single room, you avoid as much as possible contact with other people, and you don't leave your house. And so I think that's appropriate advice to follow. And in terms of whether or not it's then necessary to deep clean a place after somebody who's returned from a badly affected area, well, it's very debatable. I mean, I think it's belts and braces. You're ensuring, you're maximising your chances of having that virus spread if it's been introduced. But I think the self-isolation really is the key thing here.
Do you think that we should be stopping flights coming back from places that are badly affected, like northern Italy?
I think it's a very difficult thing to really work on, because if we take, for example, the outbreak in Italy, where we don't know where that virus came from, it may well have come in from a place where there isn't a badly affected area, but it has some under-the-radar coronavirus circulating. I think many of us suspect, we don't know for sure, but we suspect that maybe the coronavirus is already in the UK and it's circulating without us knowing. That's why the government has decided to start surveillance to see whether or not there is any evidence of the virus already being here. And I think, it's incredibly difficult. We either stop travel totally in its entirety until this virus outbreak dies out. But I think most of us think that the reality is the virus is out there. It's going to spread around the world. And unfortunately, we will have to continue to operate as reasonably normal as possible. And that means people travelling around and therefore potentially bringing the virus back.